For many years, the World Health Organization in Kenya has strived to play a key role in ensuring that the overall health goals of the Kenyan population are attained.
We work predominantly upstream, working mainly with policy makers, decision makers at headquarters, at provincial level, doing upstream functions, mainly supporting policy development in different aspects of health interventions, in health systems, human resource development, supplies of commodities and other essential drugs that are needed to run functions in various parts of the country. We also work in the area of improving the capacity for human resource in this country for healthcare delivery. We do this through skills development training. We run lots of workshops in Kenya, we give out training guidelines and so on.
By supporting the government directly or through a wide range of collaborative programs with partner organizations, WHO aims at increasing access to basic healthcare.
Community focus that government has put in place recently is really helping. Kenya is beginning to register some positive developments on matters of health.
Massive efforts have been put in place to control tuberculosis, and yet the treatment success rate has not reached the expected global targets.
The healthcare system that is in place right now needs to absorb more healthcare workers so that we can be able to move forward the agenda of fighting TB.
In order to change this trend, WHO is supporting the Ministry of Health to implement new interventions so as to help the country achieve the expected global targets.
For many years, TB program has stood on its own and it has its own core functions, and HIV program has done the same. And we have been focusing on the patients, but in a different perspective, in the sense that the HIV program has been focusing on HIV patients and HIV per se, and the TB has been focusing on TB patients and TB per se. But we have realized over the years now that the two diseases are actually going together. So what we have done in the recent past is to bring the two programs together so that we focus on a patient. We don't focus on the disease.
Such interventions include community involvement in TB care, PPM, DOTS, and TB and HIV collaborative activities.
Dalili ambao anasikia inaweza kuwa ni mambo kama coughing, anakohoa kwa muda mrefu. So wakati tunamrifa huko tunamrifa kama TB suspect.
In line with the global targets for DOTS expansion, WHO has supported the Ministry of Health in provision of both technical and financial support to the development of the TB strategic plan and development of training materials.
We are the pioneers in the whole world as far as TB/HIV activities are concerned. In terms of rolling out these activities to cover the whole countries, WHO participated and really has supported the program to develop the only TB/HIV training curriculum that is now being used in the whole country, and other countries are already borrowing because we are way ahead of them.
As a result of the fast scale-up of the preventive interventions, Kenya has realized a decline with HIV/AIDS prevalence falling from 10% to 6%.
Now, WHO, beyond just locally, the fact that they're able to set norms and guidelines internationally is very important, because these are the norms and guidelines that we're able to adopt at country level. And they set the basis for us to be able to ensure quality, not just within the country, but also to be at par with other countries.
Have you ever had sex?
Yes.
How many sexual partners?
With the launch of the 3x5 campaign, WHO mobilized partner organizations, and the support has led to the ongoing ART scale-up, especially with regard to training and development of guidance materials and decentralization of antiretroviral treatment. Through funding, WHO has supported the welfare of the people living in the underserved rural areas.
For most of the time, I've never had funding that is geared towards the community. This is the first time I've had geared, and I've used actually part of that funding to have myself travel all the way to the farthest point of the province. Most of the funding that we get are usually geared towards capacity building, training of healthcare workers, and availability of these HIV commodities.
What I can say about ARVs, they are good when you take them as the doctor prescribed. Because a long time ago, I was very thin. I never have these hairs. My body was having all rashes. And since I started taking ARVs, my body is well. I have nice skin, smooth skin. The hair come back, and now I'm fat. I can eat, I can work, I can walk long distance. So ARVs, they are life.
Currently, we have been able to reach about 120,000 Kenyans with the antiretroviral treatment. Of these, about 8,800 are children. This is as of the end of 2006.
Kenya is faced with different transmission patterns of malaria due to the wide differences in altitude and weather. WHO, in partnership with DFID, has been supporting the implementation of the National Malaria Strategy.
And one of our key partners is the World Health Organization. It's been very key in supporting in the implementation of the National Malaria Strategy.
Key strategies in place to fight malaria include improved access to ACT treatment, management of malaria in pregnancy, increasing availability of insecticide-treated nets and indoor residual spraying.
Quite a number of organizations have been involved in creating awareness about the use of nets so that they can prevent the community can prevent itself from getting malaria as a result of the many irrigation schemes that are within the region, because these are breeding areas for mosquitoes.
So this partnership has contributed to community empowerment and also community participation in health development, which is one of the key things we are going to turn around the disease burden in the country.
For intermittent preventive treatment promotion, community performances and dissemination of preventive messages has also helped in the fight against malaria.
In the marketplace is where we try to get many people gathered together. So we have taken the chances every time, when there's a collection of maybe on the market day, we feel that's when we can deliver the message better, because there are many people coming from different places.
Through a comprehensive approach and scaling up effective interventions and treatment, malaria cases and deaths have reduced.
We are also in the forefront to avail this to the community, and in our system we have selected about 10 outlets who are supposed to be pilot study.
The last 18 months have been a real watershed for Kenya, and I think the Kenyan government and its partners, including the WHO, to be applauded. First of all, they have changed from drugs that were cheap but didn't work to more expensive drugs that work very well. These are drugs known as ACTs, and the one that Kenya has chosen is artemether-lumefantrine. And secondly, they are rolling out at great scale and very quickly measures that can protect young children and pregnant women from malaria-infective bites with insecticide-treated bed nets.
A lot has gone to national level. We need to take this expertise to provincial level and district level. So I would request that support also starts trickling down to the lower regions where the actual implementation is also taking place.
Death related to pregnancy is the leading cause of death in women of childbearing age, with an estimated 15,000 women dying every year due to pregnancy and related complications.
And out of these pregnancies, we have those who die because of the pregnancies and their complications. And that is where WHO actually assists us very much in trying to reduce these deaths by helping us in a number of activities, giving us technical and financial support to support other programs that are geared towards reducing these maternal deaths.
WHO and partners are supporting the Ministry of Health adapt and implement the regional roadmap for the accelerated reduction of maternal and newborn morbidity and mortality.
That will be very useful because it is geared towards community activities.
Prevention of mother-to-child transmission has scaled up, with every pregnant mother who visits antenatal care also being counselled and tested for HIV.
The Ministry of Health estimates now about 7% of all pregnant women are HIV infected. The Ministry of Health through the National AIDS Control Program, has a major program for prevention of mother-child transmission of HIV. The key components of this have been accessing pregnant women with HIV testing, and once they are identified as HIV infected, providing them with antiretroviral drugs which would prevent mother-child transmission of HIV, and then providing counseling around infant feeding, and of course providing ongoing care for the mothers and children. We are currently involved in a study called Kesho Bora. It's a multi-country, multi-center study that is looking at use of highly active antiretroviral drugs as a way of preventing mother-child transmission of HIV. WHO is coordinating this study, and it's being coordinated actually from their headquarters office in Geneva. If we could get more funds on board, it will facilitate this study. It will mean that enrollment can go much faster, and we can be able to answer this really important question.
WHO has also contributed directly to the strengthening of specific health facilities' ability to provide essential obstetric care by donating operating theatre equipment and ambulances. Kirugoya District Hospital and Kimbimbi Sub-District Hospital in Kirinyaga District are some of the beneficiaries of such initiatives. Immunizable disease still represents an unacceptable burden of disease and contribute to child mortality.
The strategy the government has adopted is integrated management of childhood illness, and which is commonly known as IMCI. And I might say that WHO has really played a big role in the introduction of IMCI into the country, and also in building capacity. Before we started, we had a few people trained outside the country, and right now we have trainers in all the provinces.
Kenya has been polio-free for 22 years, but has recently experienced some polio cases.
Late last year that we had 2 cases, but those cases were imported from Somalia and got a foothold in one of the camps in northeastern province.
As a result, the government launched a polio immunization campaign.
We have a reference center for polio, and at the institute, and recognized by the WHO as a reference center, whereby we monitor any new strange cases of polio, and we keep on mapping this, because our intention here is to kick polio out of Africa.
Through partnership, WHO is supporting the To Return to a Polio-Free Status campaign and training health workers in IMCI for outpatient and referral packages for inpatient care. The scale-up and the gravity of health problems, which are often linked to development issues, particularly to poverty, man-made and natural disasters, has made women and children of the northeastern province in Kenya bear the excess burden of mortality and morbidity in emergency situations.
In the last few months, or about 1 year or so, had several disasters or calamities. The northern Kenya experienced the first thing, drought, which was almost failure of rains for the last 3 years. And with that came with malnutrition, because they depend mostly, the community depend mostly on livestock. And after the after the drought, many animals were killed because of lack of pasture and water. And then that affected the nutritional status of the community. So one of our major roles was really to coordinate and provide maybe a central pivot for trying to coordinate the activities of other partners. And this we really did very well. There are other agencies that work with us, Red Cross, UNICEF, of course the Ministry of Health, which we work through, and other non-governmental agencies.
WHO, ECHO, DFID and other partners have been working towards mitigating the excess mortality in the region.
Our key partners are the WHO, UNICEF, the Ministry of Health.
Through technical and financial support to disease outbreak management, IDSR was used to detect the outbreak of the Rift Valley fever.
Integrated disease surveillance and response. This is a strategy whereby World Health Organization is supporting countries. Actually, it is an African region strategy, but Kenya has adopted this strategy as a strategy to support early detection of outbreaks. And through this system, which has been rolled out in the Northeastern province, this particular disease was able to be early detected and appropriate measures taken.
We are meeting regularly here, right? Our teams in the districts were already sensitized on what to expect. So when people, even before people became sick, we had already sort of started filling in the forms, and people were, from the Ministry of Health, were collecting samples from patients who were being admitted to Garissa Hospital with fever for testing here. And the samples were being brought to Nairobi. The Ministry of Health, WHO, CDC, KEMRI, Kenya, right? We were all able to work together in handling Rift Valley fever.
We support the capacity of the Ministry of Health, both at professional and district level, to collect weekly reports on very common diseases that are prone to epidemics and diseases that are supposed to be eliminated in the country or eradicated in the country.
WHO have really assisted us because they trained our key focal point persons. Like just to mention, for the RVF cases, they trained about 40 nurses in this camp. So that was actually a very big assistance because every medical person was aware of what is happening.
WHO's core function of supporting national policy and strategic design has been crucial in the health sector reform process.
What we've been focusing on in the past few years has been, first of all, once we defined the second National Health Sector Strategic Plan, which had its clear goal as firmly reversing the downward trends in health indicators, we worked with the ministry to go ahead and define what we call a joint program of work and funding. Whenever the ministry decides that it wants to move in a certain policy direction, we are able to provide the technical input that they need. We have always tried our best to make sure that the support that we are providing to the country is tailored to the specific needs that the country has.
As a result of the collaborative partnerships, WHO continues to support the Ministry of Health to address issues of weak health systems.